Really appreciate it. Our next panelist is Dr. Stephen Montamat. Is an amazing, truly dedicated physician who cares deeply about the quality of care for his patients and their families. So what do you have to tell us today?
Well, I'm going to introduce myself like you did.
Amazing.
I am the spouse of a long-distance caregiver. You know, it's truly a privilege and an honor to be able to participate in this event. I was at the first caregiver conference last year, and at that time my wife's father was about to pass away. 2 months later he did pass away, and so we were dealing with his illness and dying, and now her mother has moderately severe dementia, and so we're dealing with that right now. So it hits home the issues that we are all dealing with, to me personally. But I am a general internist. Most people ask, what is internal medicine? And I think the simple way to say it is we're doctors for adults. So I mainly am concerned with adult health care and then specifically geriatrics. I am a geriatrician, and I work with St. Luke's Internal Medicine. And I have some patients and family caregivers in the audience here today. And again, it's my honor and privilege to be involved in their lives to try to improve it. And when I look at all the people that are involved in caregiving, I feel like I'm probably the smallest piece in all this. I think it is important to have a good internist or a good physician involved in the care team, but there is so much more that goes on. And I like to come to this conference. It makes me focus on what are the things that we can do better as a medical profession. I think, as you probably know, we're going through a tremendous transformation in the way that we care for people in this country, and we're at the very beginning of it. And I am very hopeful that it will change the way that we look at the care, especially of the elderly, that we go from this fee-for-service world where we like to do procedures and do very distinct things to looking at the whole person and being able to care for them with a team of professionals that's not just a medical professional. So I'll get off that soapbox and go on to, I think I'll touch on some of the three things that, we were asked, three things that we think is important for caregivers to know. And one thing we've already done, and that was to schedule every day some physical activity. I think being mentally sharp, you also have to pay attention to the physical being, and just that 3-minute stretching exercise that we did is amazing. I don't know if you felt it, but I was invigorated. It helped me. We listened to some wonderful speakers, but we're sitting there and listening and concentrating, get up and do that. And I think, that was 3 minutes. Who can't just take 3 minutes to do that every day? And if you get to the end of the day and you're going to bed and you just had a heck of a day and you go, gosh, I didn't even do that 3 minutes, don't beat yourself up. And then you say, okay, tomorrow I am going to take 3 minutes. That's all it takes to do my physical activity. And it's called the Kaizen method, where you try to do small little steps, and 3 minutes a day, who can't do that? And just try to do that and then build from there. The second thing I had was to reach out to others, and you're doing that today. I think connecting is very important, and not being isolated, and that's connecting with your spouse, with your family, with your friends, with your church, with whoever it may be. But you need to let them know what you're going through. One of the things you may do with them that I see in the doctor's office all the time with patients and with families is they almost want to present their best case scenario, like, look how good we're doing. And they use it almost like a test, like, boy, if I can get by through the doctor and they don't find anything wrong, or they think I'm doing great, then I am. That's not how it should be. You should be able to open up to your physician and let them know the struggles you're having. I will be honest that most of us, and we find this through the Alzheimer's planning grant that's been done, that one of the main complaints that patients and families have is the doctor doesn't really know what to do once the diagnosis of Alzheimer's is made. And I think that can be true with a lot of caregiving type situations associated with disease. We're not well prepared. We're in the medical model where we see a diagnosis and we know how to treat it, but we're not very good at the overall caregiving model, and so there's more work that needs to be done on that, and I hope to be involved in that in this valley. The third thing I had is just to make sure and take care of yourself. I think that's a theme you hear over and over again here, but it is so important, is to make sure that you are attending to your health and seeing your physician the way you know, you've been recommended to. So, I get that.
Thank you, thank you, thank you. Good. Okay. Here's your question. I feel we're like on Jeopardy or something up here. Okay. How can we work with our healthcare provider and others to determine the ability of someone to live independently? How do we do that? And how do we know when it's time to make a change in where someone lives? And how we can get an informed, objective opinion to help?
Well, first of all, making that assessment, I always tell my patients and my family, you know, when you're going to see me as a physician, as a medical physician, I'm fortunate enough right now to have 30-minute visits, but typically it can be 10, 15, 20, maybe 30-minute visits. And I'm seeing the patient in a very artificial environment. I'm seeing them in a doctor's office, and I'm not seeing them in their environment, in their home. This is true with even their blood pressure. I say, this is your blood pressure here, but I need to know what it is at home. So I think it can be very difficult for me as a physician to judge, you know, what their ability is and what would be the best care situation for them. And so I really depend on the family to come armed with information. And that may need to be done in a separate room. You may need to sneak out and say, you know, you just try to do it the best way you can without being obvious, but take the physician aside to be able to tell them other things that are going on that you might not want to say in front of the patient. Another resource we have is home health, is that we can try to, if there are some reasons that the patient needs home health, we can get someone out there to do a safety assessment and to try to figure out what is the social and psychological situation and see if there does need to be a change in the care setting. And then as far as the second question, I think most people know when there's a need for a change in the care setting, and that's not the primary issue. The primary issue is, doctor, we have these problems going on at home. Mom is forgetful or dad is wandering away, and what do we do? And that's a very difficult question for me, because I think that's where we need all the people that are here at this conference to give us the resources so that we can evaluate what are the options for different types of care. You know, the hope is always to try to keep somebody at home, but I think most of the time we know. It's just difficulty knowing what all the options are.
Right, right. Which makes a caregiver conference like this a really good opportunity for learning.
Exactly.
Thank you so much. Thank you. All right.